Good afternoon to one and all present here. So my topic for today is topical steroids as primary treatment for VOGT syndrome. We have got no financial interest. So as we all know, VKH syndrome is idiopathic multisystem autoimmune disease featuring inflammation of the melanocyte containing tissues such as the skin, uvea, ear and the meninges. And based on the diagnostic criteria, revised diagnostic criteria, we classify them as complete VKH, incomplete and probable VKH. So today, the materials and methods, our study was conducted in Vijayalakshmi Eye Hospital, Trichy. We assessed the effectiveness of subtenon triamcinolone injection 20 mg in 10 eyes of 5 patients who were diagnosed as a case of probable VKH syndrome. So I'm discussing few case scenarios. So our first patient was a 32-year-old female who presented with complaints of defective vision for the past 1 month. Her systemic examination was normal. Visual acuity, right eye was 6/60 and left eye was 6/12. Anterior segment examination revealed mild anterior uveitis. In fundus, the media was clear in both the eyes. The disc margins were blurred and they were hyperemic. And you can also see the accumulation of fluid around the macular in the posterior pole. And in OCT, you can see multiple pockets of subretinal fluid, and there is the loss of foveal contour. RP irregularities were present, and also ILM fluctuations were noted. The second patient was a 33-year-old male with complaints of defective vision in both the eyes for a period of 1 week. Systemic examination was unremarkable. Visual acuity, right eye was 6/36 and left eye was 3/60. Anterior segment examination was normal. Fundus showed loss of foveal contour, and there are also multiple pockets of subretinal fluid in the posterior pole. And OCT also, as you can see compartments of subretinal fluid, RP irregularities, and also the foveal contour is lost. The remaining 3 patients also had a similar picture of fundus photo and OCT. So management, so all our patients, we did systemic investigations to rule out any other comorbidities, and we subjected them to subtenon injection triamcinolone 20 mg in both eyes under aseptic conditions. And we also gave them topical difluprednate eye drops for 1 month, and for 1 month which was tapered, and 1 patient alone needed an extra dose of the injection. The patients were followed up to 1 year, and the visual acuity post injection was 6/6 in almost on all the patients. So you can see the pre-injection and the post-injection comparison of fundus photo and OCT. You can note that the vision has considerably improved to 6/9 in both the eyes on the 9th day, and the OCT is almost normal, and there is a significant reduction of the subretinal fluid. And this is also the photo and OCT of another patient. Here also you can see the OCT, in the OCT the fluid has reduced and the vision has also improved. So coming to discussion, VKH syndrome is a multisystem autoimmune disorder involving various skin manifestations, CNS and auditory signs. Systemic steroids are usually the mode of treatment, but we have got various side effects such as hyperglycemia, hypertension, immunodeficiency, raised IOP and also cataract. And tapering of adequate, if steroids not given adequately and not tapered, can result in recurrence. And immunosuppressants also have similar complaint, where if you are not giving it adequately and follow-up is not proper, then it can result in recurrence. And also the drug availability, cost factor, patient tolerance is also a problem when it comes to immunosuppressants. So the major advantage of posterior subtenons is that a higher concentration of the drug is delivered to the posterior segment of the eye via transscleral absorption, and there is a minimal side effect. And it is available as an aqueous suspension, and it is safe, and it is a minimally invasive treatment when compared to systemic steroids and also immunosuppressants. Conclusion, I would like to say that primary subtenon injection is a useful and a minimally invasive mode of treatment in VKH patients without any systemic steroids. So we can consider them for probable cases of VKH. Our study has got several limitations because it has a smaller sample size and a shorter follow-up. We would like to do a future study with a larger sample and also a longer follow-up, and which will help us to confirm that we can consider subtenon triamcinolone as a mode of treatment in probable VKH patients. Thank you.